Hi guys, I am Dr. Priyanka and let's talk today about Pap Smear. What is a Pap Smear? Who needs a Pap Smear? How often should it be done? How long does it take? Is it painful? And how are the results? What is a Pap Smear? A Pap Smear or a Pap test. This is a test for cervical cancer screening. All women have a uterus. The lower part of the uterus is called the cervix. This cervix can get a cancer which is called the cervical cancer. And Pap test is basically a smear test where we take a sample, we take the fluid, the discharge from the cervix, and we send it to the laboratory. A screening test is meant to be for the healthy population. So all healthy women. When you ask me who needs to do the Pap test, as a woman I am normal, I am fine, I have no problem, why should I get tested? The answer is all healthy women above the age of 25 up to the age of even 65 to 70 should get the Pap test done, because Pap test will detect if there is any infection, if there is any precancer, or if there is any other problem, even 10 to 15 years before the cancer develops. So this is a lovely test which is available to us beforehand. We can find out what is the problem before it actually develops into a full-blown cancer. This test is done in outpatient in a gynec office. You will be asked to lie down. A gynecologist will examine your cervix using an instrument called the speculum, which helps to push away the vaginal wall, and a smear is taken with the help of a brush. This is then put into a bottle and this is sent to the laboratory. It is important to understand that the thought may be uncomfortable of the gynec examination, but the test is not painful at all. It takes just 4 to 5 minutes and it is done. The important thing is that once you get the result, go and meet your gynecologist with the result. The result could be normal, which means you don't have to worry for the next 3 years, because from the age of 25 up to 65, ideally we do this test once every 3 years. After the age of 30, we can combine this test with an HPV, human papilloma virus DNA test, which is done in the same way. And if we add the HPV testing, then we can do this test even once every 5 years. So once you get the result, the reports can either be normal, there is no problem, or there can be some inflammation or infection which can be treated with antibiotics, or the reports come as a low-grade problem or a high-grade problem. A low-grade dysplasia or a low-grade lesion or LSIL, if the report comes like that, it means that it could be due to infection, and we give you some treatment for the infection, and we may even do the hpvdna testing, and then we take it from there. If the result comes as high grade, means there could be a more serious problem, so we advise you to do another procedure, another test, another examination, which is called a colposcopy, and if needed we do a biopsy. That means we take some additional tissue from that part of the cervix. If the result comes as a frank cancer, then the treatment is again different. So fearing a Pap test or not doing it because you think you don't need it would not be good for your health. January is the Cervical Cancer Awareness Month. Think about yourself, think about your health, and go and get your Pap test if you have not done it before. Thank you. Take care.